So moving away from the topics predominantly on treatment, this is something as said, Kate. So it's something a topic which you often don't focus on or really don't have at that much time to focus in our busy practice with so many patients lined up. But it's a very important factor in the way a person perceives the diagnosis of CKD or kidney disease when he's a diabetic. And if we see, there are a lot of ways a patient comes across. Some may start with just a proteinuria or a microalbuminuria and then get referred to a nephrologist. A patient may have early chronic kidney disease, probably chronic kidney disease stage 3, creatinine has just started going up at a level of probably 1.5 to, or some patient comes at a more advanced chronic kidney disease, maybe at a stage when his creatinine is reaching 4 or 5 and he's almost nearly CKD 5. So the way a patient perceives is a lot of ways related to his socio-cultural background, his own personality, and what he has preconceived notions about kidney disease. And a lot of it is actually affected by the background. So a lot of times when the initial diagnosis of chronic kidney disease comes, the first initial approach is, do I really have it? There is a lot of denial in patients at this particular stage. The denial is not very strong when in the initial stages because the creatinine appears to be just a little bit elevated, although most of the time patient don't realize that this elevation of creatine doesn't reflects a significant drop in GFR, where creatine starts going up only after we have lost about 50% of GFR. They sometimes think that probably the reports are wrong, or maybe they want to check on another, go to another doctor or go to another lab. So a lot of time this denial goes on for a few weeks to months before they accept that yes, there is a certain problem with their kidneys. And the next stage is having an anger. So the anger may be just on the situation where he's someone who has been a diabetic for a long time, already has been taking a lot of medications, and on top of that, when they get diagnosed with a chronic kidney disease, they also may get diagnosed with hypertension. They may have coexisting cardiovascular disease. They may be already on a lot of pills which have been already taking and have been affecting his overall lifestyle. And having an additional add-on of a kidney disease can create a lot of anger, which may be directed certainly sometimes to the physician who is practicing itself, not because he blames him. It is just that his outlet on that frustration is probably towards the physician. It can be towards the family members. It's just directed towards the younger members in the family or the spouse. And this anger, again, can take a varied amount of time to resolve depending on the personality and level of the way the person deals with these issues. So many times this effect of chronic kidney disease directly, the moment a person is told that you need to see a kidney specialist or have a kidney problem, the first thing which comes to their mind is that they start thinking about dialysis, not realizing that dialysis is the last stage, and it is not that anyone who has kidney disease has to go for dialysis. So a lot of myths and preconceived notions which are prevalent in society, they lead to incorrect perceptions and fears, and this particular fear can continuously affect them, not just when they visit us, but this overbearing thought about their outcome, their life, their quality of life can affect their mood at home. It can affect their mood at workplace, their ability to focus and get effective result in their workplace also might get affected. So this all pervasive low mood can overall affect their quality of life. And the most
Full screen.
feared thing is about dialysis. The moment patient knows that he has got chronic kidney disease, his family, they all start develop a fear ki when is this particular person going on to dialysis. So this all pervasive fear, sometimes anger, denial, low mood, all this can cause a significant effect on the quality of life and his engagement in other activities of living, and bring down the overall pleasure of having a good quality of life. So there are a number of factors which can affect the way a person perceives this, and it really varies from person to person. It also varies from the age We have a lot of young people who are now getting diabetics at younger years. Our previous speaker quite clearly highlighted us becoming the capital of diabetes of the world, and along with getting the capital of diabetes of the world, and the younger and younger population are getting affected, and a lot of them come to us with a presence of chronic kidney disease in their 30s, 40s, and it is one of the most productive periods of their life. So this can itself, if a young person is getting affected, that there is a kind of there is a strong denial at why I should be suffering at this age, where his when while his peers are probably doing everything. And once the diagnosis comes, already there has been certain dietary changes which have been advised because of his underlying diabetes. And the moment chronic kidney disease comes in, there are many more other dietary restrictions which come in. So that again is a factor which adds on to the person's depression, their ability to adjust. And because the person's adjustment requires also the family to adjust, there is a not just an effect on the patient, but that also uh, goes on to affect the family members, the persons who are responsible for his food at home. And a lot of times, young people who are working from morning to evening may not have access to the kind of food they require. The kind of foods provided in many of the places where they're employed can have a significant uh, effect on what they eat, how they eat, and whether they're having adequate food intake. Uh, Having another chronic illness can affect their self-esteem, the feeling of inadequacy, the feeling that they are not equal to others, the feeling that they may not be able to perform as well as what others are performing because of these coexisting problems can affect their self-esteem. Sleep is affected both maybe because of medicines, maybe because of dyspepsia, maybe because of anxiety and depression. So it can be a significant factor in their overall outcome. A thing which is not often discussed and neither the patients often come out is about sexual dysfunction, which already may exist because of diabetes or may get worsened with the chronic kidney disease on top of that, or coexisting medications. So that is something which we need to remember and probably ask proactively to a patient, which might be sometimes a major cause of depression uh, and sleep issues in these patients. Now, the topic which we were discussing both is psychosocial and psychosocial, because a lot of psychology is also affected from the way the person comes into in what kind of social background he is from. And there are a lot of social factors which affect the way a person perceives. So one is economic stability, or the way the person's economic status is. And we all know the cost of medical care is prohibitive for a lot of patients from certain socioeconomic backgrounds. So they are worried about their job security, especially if a person leads to end-stage renal disease and has to go on to dialysis. The thought of coming thrice a week for dialysis, whether he can afford that, whether he can spare the time, these become an issue. Then there are environmental factors. All persons may not work in office. Some people may be working in areas which are industrial areas which may not have climate control. The heat may be significant. They may sweat a lot, but from chronic kidney point of view, they may have to restrict a lot of fluids. So where the person works, the kind of housing conditions, do they have proper access to in the way the climate change today is in severe heat, do they have access to cooling, or in cold places do they have reasonably good access to temperature controlled environments? Is it there? Those affect a person's outcome. Education has a significant effect. Well educated people may understand the science behind our treatment better, but again, a person who is not well educated or is not able to perceive the science behind things are more likely to get diverted to a lot of other cultural beliefs which are prevalent, or go on to therapies of medicines which are promoted online, which may not have any scientific basis and may be harmful actually to that patient. So this all these things significantly affect the outcome of a patient. Presence of health coverage. Is the patient insured? Does he have any coverage under a government scheme or his own insurance, or is paying out of pocket? So these are significant factors which can affect the outcome for uh, CKD or diabetic patients. And just coming towards the end, uh, we need to remember that these psychosocial issues remain in the background, and unless we proactively ask, a lot of time these things don't come ahead unless there is enough time to spend with the patients. And these factors can influence the compliance of the patient, the outcome in this treatment, and overall affect the patient's quality of life. So with this, I will end my talk, and then we can go ahead and see in our discussion what comments are there. Thank you, sir.